Welcome to the Quantum Healthy Podcast. I'm Andeea, a licensed addiction counselor, and along with my co-host, Laura Kissmann, a quantum nutritionist, we will be inviting expert scientists, clinicians, survivors, and thrivers to distill their pearls of wisdom attained from applying quantum biology to their fields of research and everyday lives. Our goal is to bring you easy to understand principles and practices about the study of light, water, and magnetism so you can take your health into your own hands. Welcome, everyone, to Quantum Healthy Podcast. We have Dr. John Kim on today. Welcome.
Thank you. Appreciate it.
All right. I'm going to read a little bio just in case people don't know who you are. So Dr. John Kim is a functional medicine pharmacist and educator, and he specializes in biotoxin and mold illness, cell danger response, mitochondrial dysfunction, hormone and gut-related issues, or disorders rather, and complex neuroimmune conditions. So he is also the founder of Kim Wellness, and Dr. Kim is known for his ability to uncover root causes by deeply analyzing patient histories and connecting critical patterns others often miss. Now, he speaks internationally and trains clinicians to move beyond the single system thinking toward a more comprehensive system-based approach to complex disease. So welcome again. We are so excited to have you on this podcast, and we are living in a world that encourages us to try more protocols, take more supplements, do more testing, and your work really begins somewhere else. So why don't we just start with your story and a little bit maybe from your childhood in South Korea to today?
Well, my story is basically pain to glory, and pain to, everybody has that kind of story where what triggered them to get to where they are, it really matters in terms of why they're doing it. So for me, I received my Doctor of Pharmacy degree back in 2006 from Rutgers University. Following that, I did a 2-year fellowship in functional medicine through A4M Institute. And that started me in the journey of looking at hormone replacement therapy and how hormones affecting women's health and everything else. But one of the things that I always noticed was that hormone therapy was just a tip, and not only end up having to, you hit a cap in terms of what kind of improvement you're going to get, but unless you're addressing all the other upstream issues, especially inflammation, you're not going to get the overall optimal hormone results that you're looking for. And so I thought that was profound. And then afterwards, I started also working with the autism spectrum community. And that's when I got a certificate through the Defeat Autism Now. That group is no more at this point, but that group really taught me about biotoxin issues, genetic disorders, including the issue dealing with potentially vaccine injury, that could result in the autism spectrum condition children are going through. But at the end of the day, it was a mitochondrial dysfunction. And that taught me about how some of the biomedical treatments, including certain things like chelation, thinking about cell membrane, looking about phospholipid therapy, including different lipids, end up having to impact a child's health and potentially reversing it. I've seen remarkable changes where using methylcobalamin injections, seeing a child who's nonverbal start to talk again, right? So those are really the remarkable change where there is a huge issue dealing with mitochondrial dysfunction. It's not about the fact autism is being a psychological issue, is an underlying perfect storm that occurred in doing so. So why am I here on this podcast talking about whatever topic is going to be? Well, back in 2015, fast forward, I actually had a heart attack. I had an NSTEMI. And it was very much unexpected. I just came back from my friend's wedding 3 days later, having this severe heartburn, which I always end up having to deal with. And that pain didn't dissolve, actually got worse. And that pain shot down to my left arm that evening. So instead of going to the ER, I still slept, woke up the following day, went to work, still the pain not resolved, went to the urgent care center. And then they looked at me, they're like, "You're having a heart attack right now. We need to get to the ER." So I got to the ER. And they did several testing, including look at the troponin level. Troponin level was less than 1. They got the cholesterol testing from 6 months prior, was completely normal, right? EKG was normal back then, right? So why is it the fact that a 33-year-old having perfect cholesterol, quote unquote, having no other issues because the person was pretty fit to begin with. Why is it that having a cardiac manifestation all of a sudden and then troponin level is less than even 1? So this is where the ER doctor said, I think you're dealing with pericarditis. We're going to send you home tomorrow. But when they did an echocardiogram, my left ventricle, lower left ventricle was not pumping at all. So sign of ischemia. So went to the cath lab, get a stent put in because they found they had an 85% blockage in my LAD, right? And became the youngest patient to get a stent put in at Morristown Medical Center. And afterwards, I was in the cardiac ICU unit for 3 days, just wondering what the hell happened, because I thought I was living a pretty good life. I was not. I had a lot of issues to begin with, but I was completely ignoring it. But at the end of the day, why is it a 33-year-old end up having to come in with a 85% blockage in dealing with this? But also one of the things that I got scared was, am I going to have a secondary heart attack, which is very common if you end up having to have an early stage of heart disease to begin with. So this is where I went in a rabbit hole trying to figure out what could be potentially happening there. So I went to my integrative doctor. All I wanted to do was vitamin C drip, just get my energy back. And she looked at me and she says, I think you're dealing with some kind of tick-borne illness. Let's do some testing. So after a month and a half, that's when the results came back. I tested positive for Bartonella infection through IGeneX, high levels of Aspergillus antibodies, Mycoplasma pneumoniae, Epstein-Barr, heavy loads of mercury, because I used to play around with mercury balls as a kid. Used to intentionally break mercury thermometers and then play with the mercury ball.
Oh my gosh.
This is how I was when I was a kid. And then the last issue that actually I deal with, severe issue doing parasites. So why is it, and how is it that even this is possible? Well, I lived in a moldy house to begin with. I grew up in the summer camp as a Boy Scout. So that's probably where I ended up getting the Bartonella. I don't recall any getting tick bite, but it's not just tick. You're talking about other vector-borne illnesses like spider bite, mosquitoes, that you can end up contracting this particular disease. And then a moldy issue, like I said, I live in a very moldy house. I still remember my basement to be completely black in certain areas. My parents ended up having to bleach it. That's the worst thing you could do, but that's how I grew up. But another added issue is the fact that I grew up in a very troublesome household. And that caused major unpredictable matters that would occur in the house. So as a child, being emotionally neglected, end up having to also impact on the stress, it causes major neuroinflammation. So it becomes a chicken or the egg discussion. Did the mold cause more neuroinflammation? Is it the fact that neuroinflammation due to the stress response end up having to become an entryway because the gut-brain axis is getting involved? Now you're dealing with leaky gut and other entry point of mitochondrial dysfunction. That mold becomes a huge burden on the body, and then everything else follows. I think my theory in terms of the latter makes more sense in terms of what I'm seeing in terms of the patients now I see with severe mold and MCAS problem. But that was an underlying issue that I was carrying through. And the troubling side I always had was I had very bad breath. I had acne all over my body, right? I was dealing with indigestion, heartburn, food sensitivity issues, so already an MCAS and histamine response already dealing with. And then I would not even think about fixing the problem until I actually had a heart attack. And then thinking, I'm like, shit, like there's a big problem here. So it took me 2 years working with my doctor, ended up having to clear my Bartonella infection, including mold. And that really gave me an entry point into learning more. And then at that point in time, I met Dr. Ed Kane from Body Bio. He analyzed my blood work, looking at the red blood cell fatty acid analysis, and seeing how lipid membrane structure, especially talking about cell membrane, is a critical part of really getting your body back in order, right? So when you talk about all these biotoxin issues, it not only causing a burn in the body, but specifically it causes mitochondrial dysfunction. And then you're talking about enzyme, certain mold toxins especially causes lipid peroxisomes. And then these end up having to impact how certain bioproduction can actually occur as well. So especially like aflatoxin, ochratoxin and triclothecins, those are two mold toxins. They stop the rate limiting steps of how bile is getting produced, on top of stops the bile getting transported in the gallbladder. So that also affects how you end up having to metabolize cholesterol, lipids, toxins, all those things right now, right? So that's another thing. And it also affects vagal nerve response because of a neuroinflammation, right? Trichothecens, for instance, actually causes blood-brain barrier to be leaky. When you have a leaky brain, you have a leaky gut, right? And then
Yep.
you're talking quantum aspect of it that actually increases deuterium content, right? So all these things are end up having to impact on the body. What I'm trying to tell you today is the fact that everything becomes a triggering issue on the mitochondria. And nowadays, the reason that people are sicker and sicker because the overall environmental matter around us, including nervous system regulation, including toxic blue light, and then non-EMF, overall impacts the body, and the body is completely overwhelmed and doesn't know how to get back to baseline. That's basically it. So in terms of what we're trying to do now, it's not just about giving supplements, trying to detox. How do we get your body back in order to safety and then resolving the underlying issue and the upstream problem and then getting your body back in order? So this is where me looking at circadian rhythm and as well as how cell membrane structure is really vitally important. The nervous system aspect of it is really important as well. But the last thing is the environment. How safe do you feel at this point in time? And oftentimes people are not safe, right? Even though they might not be having a threat, let's just say they moved out of the moldy house, they're still sensing a threat because body does not know how to turn that off. So this is the critical part that I help clients with right now.
This episode is sponsored by VIVARAYS, the only eyewear company that truly understands your biology. VIVARAYS are advanced blue light glasses designed with circadian biology in mind. Unlike typical blue blockers, they filter light in harmony with your body's natural rhythms, helping you sleep deeper, feel more energized, and protect your long-term health. We love companies that support biology-backed wellness, and VIVARAYS is leading the way. Use code QuantumHealthy at VIVARAYS.com to save 15% and support your sleep, focus, and natural energy the way nature intended. Enjoy this episode.
Oh, yeah, so many aspects to that. Yeah. Andeea, were you going to ask something?
Well, one of our questions was what kind of clients that you attract. So, you just went through a laundry list of issues that people have. And I love how you, at the end of the day, you're able to say it's just the body not being able to get back to baseline. I have never heard it explained all like that. That was beautiful.
Yeah, but that's basically it. All these things in terms of influencers talk about mold, talking about Epstein-Barr, Lyme disease, all that. At the end of the day, is the body is not able to get to baseline. That's what it comes out to, right? So, and it's also lacking coherency and it's also lacking in redox potential. That's all because of lack of coherency. Your coherency state creating, all those things are able to be regularly resolved on its own. The body is supposed to be doing that, right? Why do we lose concept or why is it that we're losing this particular function? Is because the stress response is too overwhelming, leading into the state called cell danger response in the body.
Okay, so yeah, many episodes ago we had Kelly Croft on, Kelly Erickson, she goes by as well, and she talked about cell danger response, but that was probably a year and a half ago. Can you explain really what cell danger response is, and then and just how it's probably changed your approach to treating clients?
Yeah, absolutely. So cell danger response is a coined term made by Dr. Robert Navio. Dr. Navio, he's an MD, PhD out of UC Davis. And the reason they came at this concept of cell danger response was to explain about the physical and the biochemical manifestation that goes on within the autism spectrum disorder. So many things in terms of explanation to why a particular child ended up having to go through injury. And second, why is it the fact that the child's not to get any resolution into the condition they're dealing with? So this is the main work that he was going through. So he actually ended up having to look at and explaining what's happening within the mitochondria. Now, obviously that was a theory, but his metabolomic lab is able to now see that is actually truth behind that as well. So what is the cell danger response? It's a evolutionary mechanism the body basically built into itself to protect from particular threat. And they're like, what threat are we talking about and why is it protecting it? Well, the threat-wise are four ways of looking at the threat. looking about biological threats. So we look about viruses, bacteria, parasites, and fungi. And then there's chemical issues, volatile gases. You're talking about glyphosates, heavy metals, and then different solvents you're dealing with at this point in time. And then there are physical stress as well. UV radiation, right? You get sunburn, that is a physical issue. Getting a burn, you're getting an injury, traumatic brain injury, all that, that's also a threat. And then we'll also have to add, and nowadays non-native EMF that impacts the physical issue as well, because people who have hypersensitivity problem, they feel like their body's vibrating next to a Wi-Fi signal, right? So these are all physical manifestations. And the last thing is psychological and emotional trauma leading into the issues here. So what is this? So the threat end up having to be impacting how the cell's functioning. How is that even possible? Is the fact that your mitochondria is not just about making ATP, right? It's also about, as a sensing organ, it senses and as a master of the entirety of how the body is functioning at this point in time. So what the reason that people are sick and getting worse is because of you have an unresolved cell danger response onto the cells in the mitochondria, and the mitochondria is supposed to be dictating this whole healing cycle. It's not able to get the resolution it's looking for. So it's completely stuck. So that's where cell danger response comes, the discussion comes in. So instead of actually going through oxidative phosphorylation into making ATP, now the mitochondria is telling this other functions to go into glycolysis. Very poor ways of managing energy to begin with, but this is what's happening at this point in time. So instead of creating energy, now it goes to a threat mode, right? So now the mitochondria is detecting the particular threat and is going to a complete lockdown mode as well. So what it does is, let's just say we take a virus, for instance. The virus goes into your body and then triggers a cellular depolarization with the cell membrane. And who detects that? The mitochondria does. And the mitochondria is like, wait. That doesn't belong here. You came in, I'm going to lock you in here. So this is where the mitochondria that dictates producing phospholipids and ceramides to lock in the entire cell membrane. As you start doing that, that's where the cell-to-cell communication completely lacks, right? So when that actually happens, the mitochondria now also start to increase antiviral, antimicrobial enzyme within the cells trying to neutralize this. And another role that mitochondria try to do at this point, that because the cell is completely damaged and trying to contain that particular problem from spreading, it goes through, at least tries to go through mitophagy and autophagy, right? So it's a natural ways until cells getting recycled and forming back. It's a natural process, right? If you have a poor ways of doing that, what happens? Cancer can actually occur down the line, right? But another critical thing that mitochondria also does is it shuts down DNA methylation, because the virus particle actually can hijack the DNA methylation and then start to ramp it, causing chaos and increasing reactive oxygen species to be occurring. So this is a manifestation that the mitochondria are trying to stop doing. But what is the functional medicine these days? And this is the reason why I hate functional medicine these days, because we just end up having to throw supplements at the problem, not look at the entire context of biochemistry, is give methylated B vitamins at the wrong time. Give antioxidants at the wrong time, actually causing more stress in the mitochondria. When the mitochondria now is trying to shut that entire process down to contain the damage and trying to move forward into creating homeostasis back in order. But this is the critical part that we often miss. You could do all the testing you want to, and there's another problem too. You could do all these scans and testing. If you don't know how to interpret that results and then giving a sequential roadmap in terms of how the body's responding and where they are, everybody's journey is different, where they are, and look at the context of cell danger response, it will be very difficult to getting the person's resolution done because you're using the right tool at the wrong time. And that's the critical part that no one ended up having to discuss about, including, like I just mentioned, about the whole DNA methylation. But another thing that the mitochondria now does is, instead of actually creating energy, I mentioned about the ATP, is now becomes an extracellular ATP. It dumps out ATP out of the cell. Now that ATP is not energy, it's actually a cellular signal to tell other cells that there is a particular threat at this point in time. I'm damaged. You got to be on a lookout, right? So that in itself, when unresolved, it goes into a DAMP, danger-associated molecular pattern, and the body's completely stuck because of that reason, right? So this is the critical part that's not talked about, and the reason why people are going through chronic fatigue and issues in terms of that. Everybody's like, oh, chronic fatigue, Epstein-Barr. It's true, but there's a lot more issue than that. Some underlying mitochondrial dysfunction already happening because of cellular threat, right? Not looking at that and just throwing some, Epstein-Barr focused supplements and such doesn't fix the problem.
Yeah.
Molecular hydrogen also at the wrong time can be a very critical problem as well, because you have an unresolved issue that goes on within the cell membrane and also the critical part of the mitochondria that is not being talked about. And another thing is the body is so smart in terms of trying to resolve that. So it's taking ATP, sensing and doing so, and then turning into special pro-resolver mediators. That's a key mechanism. The body turns in extra ATP into SPMs to resolve the underlying inflammation. The body's very smart, but it's just overwhelming response is too much that now people are sick and they're getting stuck. So that's basically a cell danger response in a nutshell. And then the whole thing now is going to the healing cycle as well. The mitochondria dictates how the body's going to heal. We talked about how the cellular threat actually occurs. That is basically something called CDR1 or cell danger response 1. Now, once the inflammation has been somewhat resolved, it goes into CDR2 or cell danger response 2. That's a proliferative phase, right? Still in the glycolysis phase, the body's not able to turn the ATP correctly, and it's an unresolved issue. Now, these things end up having to cause a bigger problem where when there's an unresolved or uncontrolled proliferation going on, which is needed, that's cancer, right? So this is where the body, and why is it the cancer can occur? Because unresolved issue with the cell danger response there. So that's CDR2. But another thing that actually occurs is you have buildup of senescent cells as well, zombie cells basically. Those has to be cleared out. And that's where the buildup actually occurs and unresolved issues. And this is where like spermidine and all these biohacking tools can be very helpful. But again, there's an unresolved inflammation going, unresolved upstream problem. So that has to be resolved. So as you start to resolve this, and one of the associated issue with cell danger response 2 is some of the metabolic issues like hypercholesteremia, diabetes, right? IBS. So those are things that end up having to be cancer, especially, right? Keloids, scar forming. Those are all part of the CDR2. Now you might be wondering, like, how is that scar forming? This is the reason why it's an unresolved issue. And then as you start to resolve the cell danger response 2, now it goes to cell danger response 3 or CDR3. This is the differentiation state. This is when the hormone and cellular communication actually gets reconnected, right? Natural enzyme being produced, right? And then these are things that when all the cells start to turn on, but when there's an unresolved issue and there's a poor way to turn these cells on, and there's a major impact on the cellular response, that goes into development of certain disease states like autoimmunity, chronic pain, autism spectrum disorder, right? So this is where the manifestation of all these disease states we're seeing right now is basically unresolved cell danger response. Right? So you have to, so the main question you had is, knowing this and how do I see this, how is it dictating my clinical practice? Well, first off, in terms of where they are, really dictates what type of modality I'm going to be using to help really move that needle for that particular client, right? I mentioned about some of the antioxidants, especially glutathione, giving it at the wrong time is not the right thing to do. Matter of fact, giving glutathione on a mold toxin patient, it can make the mold toxicity issue even worse. Because when you give glutathione at the wrong time, it can stimulate that particular mold that's colonizing the body to increase mycotoxin in the body. Why? Because it's sensing a threat. The mold is supposed to be there to survive in your body, but now it's sensing a threat, like, hey, I gotta get this resolution done, so I have to survive. So it's producing more mycotoxins. So glutathione is not the way to do it. Okay. And also adding in antioxidants too rapidly increases more stress response at the same time as well. So all these biohackers that are talking about, these are the all in all about how helping the cell membrane or the energy production and such, including an NAD, it's just crap. I mean, you got to understand the concept of cell danger response, and then adding these things in proper time. Adding in wrong supplements at the wrong time, right supplements at the wrong time can actually affect more cellular damage.
You know, I've heard Dr. Alexis Jasmine talk about that. I can't remember what podcast it is. I've been trying to find it, but she was talking about how she was speaking to another, either a colleague or a doctor about NAD supplementation, and that basically what I remember of the conversation, the way the mitochondria works, it is technically impossible to have an NAD supplement. Like, I'm curious what your thoughts are about that. And then just, do you have any common, like you've been listing some really common supplementation that people typically will do that you see is actually more damage than.
Yep. NAD is something that your body already utilizes as a cofactor.
Right.
The issue is that the reason why there's a low NAD level, or at least that's what they're touting, is because of cellular threat, right? So, and also, in order for NAD to work well, you have to have a right forming cell membrane as well, right? All these different types of peptides at the same time. Adding those in is not going to do well when you have an underlying cell danger response, because of the fact that you have a cell membrane is completely damaged. Where does receptors end up having to be formed for the peptides to work well? Cell membrane.
Yeah.
Right? Even the electron transport chain, in terms of where the NAD is supposed to be helping, CoQ10, PQQ, all these different supplements, where is it happening? You get electron transport chain.
Right.
What do you have a biforming cell membrane? So the critical part in terms of the basic is completely tossed on the left side over there, and then just end up having to look at what's shiny and new, right? So this is why actually now diving in, I'm like, why is it that some people are stuck and some people are able to get resolution and understand the cell danger response? And looking at this, you have to go back into the upstream issue redox issue you're dealing with right now, right? I'm not an expert like Dr. Alexis in terms of the whole quantum aspect of it, or Dr. Jack Cruz, but to understand the concept of cell danger response and how that's affecting the entirety of the biochemical route and how it makes sense clinically, this is where my expertise comes in.
I was going to ask, like, are there any supplements that are generally safe, like magnesium, deuterium depleted water, or body bio, like PC oil? Like, are those, because you're building the cell membrane and that's what's needed at the time, and then or is deuterium depleted water too soon? You know, are there things we still need to do first?
Well, we could be discussing that later on, but just kind of give you, a little preview of what we could actually talk about is the fact that sequence matters. Right. Sequence matters. Like where that person actually is at, and then where you're trying to go is the most important part. Because if you don't have a roadmap of where you're starting and where you're going, it's very difficult. And oftentimes, like I said, the right supplement at the wrong time, it just makes the condition worse. So let's talk about the aspect of cell danger response and what it's causing. Well, when you have an innate immune response going on, and especially aka inflammation, and that actually ligates and damages the cell membrane, and that leads into the lipid peroxisomes getting built into the lipid bilateral structure. Right. So peroxisome is basically, let's just think about it as like a burnt toast, basically. Right. Your cell membrane is completely toast because of the inflammation. And you actually have these renegade fats, which is basically the byproduct of the wrong fats being and having these issues that you're trying to resolve on that aspect of it. So what do we do? The body's actually very smart enough to, as long as you get the right building blocks of it, to fix itself, right? And this is where the right supplementation really comes in. Phospholipids are a really critical part of this entire discussion, right? It's this, the outer structure of your cell membrane is composed of phospholipids. And that phospholipid complex, 70% of that is phosphocholine, followed by phosphonethanolamine, inositol, and serine. There's 4 complex there. But within the inner membrane, you also talk about cardiolipin. You also talk about different various of cholesterol. And then you actually have a linolate, which is omega-6, and alpha linolate, which is omega-3. Right? So all those are critical part of the cell membrane. Now we talk about ceramides as well, but that's the whole thing that comes into play. So I mean, there's different theories of looking at this as well. So I actually run something called the red blood cell fatty acid analysis to see what the cell membrane structure is and how much of the damage that is. That also gives you your customized approach in terms of replace the right fats. But the critical basic thing is always phospholipids there, right? That's always missing. And oftentimes when you have a very poor diet to begin with, there's a very much issue in terms of lacking in the right omega-6. So adding in Body Bio's phospholipids or PC, Body Bio's balanced oil is a critical part of that. And then sometimes and more, nowadays I see that these clients are also needing a gamma-linolenic acid. And that's where use of evening primrose oil could be very helpful in this context.
Okay.
Now, so those are the things that are a very important part of it that you could add in to really support cell membrane structure and such. But oftentimes, some people are very sensitive to that as well. So again, right supplement at the wrong time can backfire. So this is where proper management and looking at the history is very critical and where they are. Use of use of some of the other bioactive oils like black cumin seed oil can be very helpful for managing on mold, and then as well as helping to deal with NCAS. The thymoquinone that's actually in the black cumin seed oil is antimicrobial and antifungal. It actually has been shown to decreasing aflatoxin issues. So very powerful ways of doing that, but also has a good amounts of omega-6 and omega-9, omega-3 to replace. So it's a good supplementation along with the phospholipids. Like things like black sesame oil could be also helpful for MCAS as well. And there's many components doing that. But again, it's all about how do we customize that particular protocol in doing that. So that's the right way approach of looking at it and understanding, and then look at this more in a critical matter rather than just thinking that it follows the same pattern. It would never be the same pattern.
You don't have a sleep problem, you have a lighting problem. Most modern LEDs flood your home with flickering blue-rich light that keeps your biology stuck in a daytime mode, delaying melatonin and spiking cortisol, and harming your sleep. It's time to get back in sync. Introducing the Better Sleep Bulb by In Rhythm. It's the only flicker-free, infrared enriched, triple mode, dirty electricity-free bulb designed to mimic the natural shift from sunlight to firelight. Toggle between 3 modes to effortlessly support your body's need for repair and deep restorative sleep. Stop fighting your biology and start supporting it. Use our code QuantumHealthy for a discount. Click the link in the show notes to transform your home and your sleep tonight. I used to be really involved with activation products. I don't know if you know that company, but they have beautiful oils. Pardon me?
Ian Clark, he owns Activated Products. I love him. Yeah, he's probably my unsung hero in that concept. He's very
yes, yeah.
As well. But one of the things that we often forget is how critical for mitochondrial function in terms of aligning the body back into a circadian rhythm.
Oh, thank you for saying that.
So especially mold end up having to impact the circadian balance. And this can actually affect how the body's immune response happening, also this metabolic process, including cell membrane function and more. And especially when you have a poor circadian rhythm, that also affects how the body's structuring water, the exclusion zone criteria, right? Easy water, basically. And as well as the sun is so critical in terms of making its body's own antioxidants. Right? The reason that you end up having to getting UVB exposure middle of the day, obviously vitamin D, right? We know that vitamin D is not just vitamin D. It's not about 25 hydroxy. There's a lot more component of different sort of vitamin D the body ends up having to produce. But the most critical part is the fact that the body actually produces its own melatonin, right? Intracellularly actually act as antimicrobial and affect and positive change the cell membrane there, right? But also that also helps to deplete, to tear them out of the cells at the same time. So there's a component of when I work with clients, it's all based on the circadian biology first, and the nervous system, then cellular health, then optimizing detox pathway, then rebalancing microbiome, and then enhancing resiliency. So this is my methodology called the Encore method.
Yes,
right?
we were going to ask you about this. Thank you for introducing it.
So that's where the critical part that we have to understand is all about the sequence, where they are, but the most basic part is how do we create an environment for you to heal? So this is where light biology is so, so critical here, right? Use of sun and it's very, especially infrared, right? Those are really component things that we want to look at, including UVA and UVB. So one of the app that I like to use nowadays, I actually give that to my clients, is my circadian app by my friend Sarah Klein. I'm quite sure you know who she is.
Yes, of
Yep.
course.
So that's been really critical in terms of just helping to coach clients in terms of what time they need to wake up, what time they need to go out in the sun, where the critical part in terms of UV exposure you need to have. So those have been very, very helpful, including the light exposure, right? So minimizing at least the lux count below 10 is so critical in terms of the melatonin production and circadian rhythm that I oftentimes tell clients to at least stay in the darkness for about 2 hours before they go into sleep. And not saying to complete in the darkness, but at least minimizing, right? So, and you could do that with, red light bulbs and incandescent light bulbs. Those are really helpful to manage these things and then doing so. So that basically sets the precedence in doing that. And then as you start doing that, start cleaning up the environment. You probably want to hire a building biologist to come in and assess what kind of mold exposure you're dealing with, along with the non-native EMF. And the reason that I think, and I mentioned this even before I started this podcast, the reason that people are dealing with more mold issues nowadays is because of the overexposure of non-native EMF in their environment. The more non-native EMF you're dealing with is not only then going to impact the cellular function, right? We know all this, but then also causes the mold to actively grow because it's feeding off that radiation to begin with, right? And then we talk about the body, it's also causing that problem. So that's where it's critical part in terms of reducing non-native EMF is so, so important. You should not be wearing any type of Bluetooth device on your body, right?
No.
If you need to track your sleep, you could wear it, but nowadays, even that's a problem. With the newer generation Oura Ring, actually emits this green light to detect for oxygen saturation, but that also emits that particular blue light and is stimulating that body, right? Because why? But bodies all have photoreceptors.
Mm-hmm.
And that's not very helpful either. So severe clients, I tell them not to do anything else. If you're not that bad, I mean, it's what it is. But if you're really bad, I would not recommend any type of light exposure like that. Making sure your sleep environment is actually very sound. But another thing that we forget to look at, not only blue light, is the current relationship they actually have with their family members. If you have an abusive household, maybe you're dealing with mental, emotional stress in the house, maybe there's generational trauma issues, it's going to cause more hypervigilance state in these clients, right? So those are the natural ADD types, right? They're trying to figure out where this particular threat kind of comes in and try and look for that particular issue. So this is where once we start to work on that, we have to simultaneously work on the nervous system response as well. So creating heart coherency is really, really important. So I teach clients about how to do heart coherency or heart map breathing. And another thing that we have to look at is any other emotional release that requires that. So EMDR is great for that. Fascia release. So fascia, we know there's a connective tissue. It's much more than that. It has a structured water inside cells, carries a lot of memories and messages and etc. that has to be released at the same time. So those are also a critical part. And then the third part is going to be the cell membrane and cellular health. We know that the sun exposure is critical into circadian rhythm in dealing with the cell membrane function and making energy. Well, this is where the right types of diet. So I recommend doing more of a seasonal-based, paleo-based diet, removing oxalates, gluten, and any types of a moldy food, critically like grains. I would recommend getting rid of. Right, you need the right amount of carbohydrate, but not so much. But that's one way to start that protocol.
Because there can be lots of mold on grains that people don't realize, right?
Yeah, I mean,
is that one of the reasons?
well,
Other than it's inflammatory.
Well, not always, but the grains after the harvest and how it's been stored is a problem.
Yes.
Right. So this is where the aflatoxin can come in. But also what they found is that the particular feed that the animals eat also has mold toxins as well. So specifically, they found out that cows and pigs, there's a particular mold toxin from Fusarium called sonulolone, which is an estrogen mimicking mold toxin. They found out that mold toxins cause infertility issues in animals. right? So now that could be secreted in the milk.
Yeah. So even if you have a regenerative,
Well, that's a whole different discussion. Regenerative farming is a little different compared to like commercial farming.
okay,
But
so you're talking about commercial.
commercial, but if you are having hypersensitivity issues to begin with, I would not recommend any milk to begin with right there. Everybody will be say differently, but at least for the first 2 months, I try to get rid of all the things that are already bothering that particular person. At least not you could do a food sensitivity testing as well, but without spending a lot of money, just get rid of all the common things that's bothersome, especially corn, soy, oxalates, right? Moldy food, right? Those are things that grains are a really important part to get rid of, right? You have to look at also the type of coffee you're drinking as well. So ochre toxin, for instance, is a very common mold toxin out of coffee. And those can actually not only affect the gut microbiome and such, but also can embed into the cell membrane and the DNA structure, and then also affecting ways in terms of how your kidney tubules are functioning. It causes mitochondrial dysfunction in the kidneys. And then it also affects the aldosterone. You're now dumping minerals at the same time, right? So it's critical part to look at minerals as well, right? So why is it that these clients deal with all these low magnesium samples and having low vitamin D?
Mhm.
Could be non-heavy MF because you're dumping magnesium from that, but also it could be the fact that you're dealing with mold toxins, and now you're actually losing a lot of necessary key minerals at the same time. So right supplementation of magnesium is needed. Not saying that you cannot, but overemphasizing on that and not fixing the environment is another problem. So it's always an important part. So going back to cellular discussion, yes, you have to, we talked about how lipid peroxisomes and then cell membrane getting damaged. So ideally, body bio PC, their balanced oil are two critical things I always add in for clients. If I see an unresolved inflammation, that's where the resolving product, which contains an SPM-based DHA and EPA, is also important to add it in. But that does not replace your fish intake. Right? You need to have cold water fish because it provides necessary DHA to do what? To keep your electrical charge in place in your cell membrane, right? So food is necessary. You cannot just out supplement yourself without having proper diet. So that's a part that I always have to emphasize on. And then use of things like butyrate, sodium butyrate actually act as a chemical chaperone to bind to aflatoxins or any type of mold toxins to get rid of that. Use of TUCA is also important as well in this part because not only supports the bile production and bile flow, so it acts as a secondary bile salt, it relieves stress from the endoplasmic reticulum as an impact of cellular function and inflammation. And lastly, it actually helps to unfold improper protein misfolding that goes on. Okay? When you have a cell membrane damage, in terms of how also the DNA structure, it's now transcribing poor protein folding aspect of it. So this is where TUCA comes in, helps to mend that issue. So things I tell clients is this. Easy way to understand how cell membrane approach is occurring in my point of view is you utilizing sodium butyrate to come in, act as a chemical chaperone to cleave off the actual toxin away from the DNA and the cell membrane structure. Phospholipid comes in to sweep that away, but also mend the cell membrane correctly, almost like a cementer, like cementing it. And then you actually have the linoleic and alpha linolenic come in to really help to put proper structure in that particular house where the missing brick is happening there. And
Love that.
go further, adding in more cement. And then in order to have a proper management of that house, having a smooth road, this is where the TUCA comes in to mend that protein misfolding and really carrying that through. That's the easy analogy that I actually tell clients how to look at cell membrane and cellular health, and lipid replacement therapy is a critical part of here. That's why you need a necessary healing essential fatty acid in this context. And when you have a well-functioning cell membrane, this is where the cells are able to function very well. If you have a well-functioning cell, then all the nutrient could be properly utilized, right? So it's a critical part. But the most important part is the basic circadian rhythm, structured water. You could add into deuterium depleted water if you could afford to do so, but you could also eat deuterium depleted food as well, right? So this is why food intake, adding in seafood is so critical part, right? Especially like oysters and raw salmon, sardines are critical. Also keeping the body more into ketosis, also the critical part at the same time. All these things I'm telling you right now is impacting cellular health. And then we're looking at the optimizing detox pathway. I've mentioned about how bile production gets impacted. But how it gets affected is that ochratoxin and trichothecene, these are two toxic mold, they end up having to impact how bile gets getting produced. So there's a key limiting enzyme called cytochrome 7A1 enzyme. Cytochrome P450 is a part of the entire phase 1 metabolism to getting toxins out, especially drug metabolism, really rises into this part. But there's another enzyme called 7A1 to help with bile production. Well, ochratoxin and trichothecene block this key limiting enzyme, so you can't produce bile that well. Another thing that those two things impact is something called B7, bile salt export pump. So you cannot excrete bile correctly out either. So you have a stagnancy of the bile that's happening, so you cannot quietly detox that well. Right, so it's a critical part to adding in something like bitters, some of the things like ox bile support really help with this in this condition, right? Vodka is very helpful in this scenario as well. And then we're looking at, you could even use castor oil packs if you like to, so that's another good way to do so. But generally, when you are getting optimal level of phospholipids, it's also increasing bile flow at the same time, right? When you're creating bile, you're also producing phosphocholine in the body. So this is where the critical part of phospholipid replacement is so helpful in this scenario, not only for cell membrane, but for your bile production. So this is another thing at the same time. And then when you start to work on this, and then your circadian rhythm also detects how the bile getting flowed, right? So
Laura had a question on that.
Yeah. So all these
you just asked it, yeah.
So all these things that we're trying to do right now is to optimize that organ pathway, trying to remove all the stressors out, but optimizing in terms of how the environment is trying to heal us. So this is a part that's really helpful for mold detox there, right? Gut function is another thing. If you're constipated, you should not be taking binders, right? That's the critical part that you have to fix. That could be from circadian mismatch, could be from nervous system dysregulation causing poor vagal nerve tone, but it could be from over issue dealing with mold and it's slowing the gut motility down as well, right? So things that help with that, like slippery elm could be helpful, super aloe, ginger could be helpful in terms of increasing gut motility. Many ways of doing that. And then sodium butyrate as well actually increases gut motility. So if you are able to tolerate it, that's one good way to add in there. So I try to optimize sodium butyrate from Body Bio, at least within like 2 to 3 months of working with the client. And then next part is to rebalance the microbiome, right? We're not just throwing antifungals at the problem, but we want to really also, there's a sequential matter of addressing these problems. So first, we want to address the fungal overgrowth in the gut, right? You have to fix the gut first before you do anything else.
Before you add a probiotic, right?
You cannot add just any probiotic at that scenario, and it's going to cause a massive amount of mast cell issues as well, right? So specifically, I like using more spore-based probiotic there, use of immunoglobulins to bind to endotoxins and lipoprotein saccharides to reduce the burden the body's already going through, and then adding in things like golden thread or millet or any type of herbals to reducing fungal overgrowth, right? It's also critical in terms of looking at how the person's lab is also, but just kind of give you a quick synopsis of what I do is that's what I do. And as you start doing that, we go more rapid issue in terms of dealing with the systemic mycotoxin issues, and then the bacterial overgrowth, especially when you have a SIBO, you definitely have a SIFO, which is small intestinal fungal overgrowth. So definitely fungus and bacterial overgrowth can be happening. This also is a good time to start addressing like Bartonella and Lyme disease there as well. And you start doing that. And then lastly is the parasite issue. And some clinicians will say, parasite end up having to harbor all these different things. We got to start with the first. Oftentimes, it actually causes more reaction than anything for people. So again,
if you deal with them, if you try to do a detox,
way too early. Yeah, I'm not saying not to. That's that. But the other part in terms of the whole quantum aspect, quantum discussion actually occurs that parasites is not an issue as long as you have a right redox potential, right electrical charge, which is true. And there's a study looking at that where cell membrane, well-functioning cell membrane has been shown to repel parasites, especially toxoplasmosis. So it's true, right? It is true. I'm not saying that's not true. It is true. But you have an underlying problem with cell membrane to begin with, you're gonna need some little help. So I don't say not to do parasite cleanse. At some point you need to, right? But don't do it too fast. You have to also sense how the body's functioning. So this is the avenue of how we're looking at the viral impact as well, Epstein-Barr and cytomegalovirus is another thing. And then the last part is how do we produce enhanced resilience in your body?
Mhm.
You could do all these protocols you want to, but if you don't have the right foundation, if you didn't do all these line of work, and then not having the resilience you're looking for, then you're going to go through the whole gambit of this problem over again if you get re-triggered. This is a part that I try to teach clients where, and I say this in a very loving way, at some point, I don't want to ever see you again. Not because I don't like them, but they're
Yeah.
done with.
Yeah, you want, yeah, you do. That's how I say to my clients, I don't want to see you again. I'm an addiction clinician. I don't want you back, right?
You know, just get together, done, Ben, and just live your life. Enjoy. Go travel. Go eat. Like you need to do that. But one of the critical things that you have to do is you still need to work on your circadian rhythm. You still need to work on your environment and your nervous system. That is a tool that I taught you
Mhm.
out there. And then
Always, right?
right, so that's the critical part. So oftentimes, if it's an uncomplicated mold issue, I usually clear the mold issue within 4 to 5 months, and they're done. Now, if they're doing MCAS and other severe issues, that takes a little longer, a lot longer, right? Sometimes it's a trial and error. Sometimes, things that you think that's going to work for some people doesn't, right? So you have to really be mindful in terms of where that is. But the most critical part is the basics, right? Basics of circadian rhythm, basics of nervous system regulation, making sure your environment is actually clean up, working your cellular health. Those are all critical part that we have to do. And then if you are having a lack of control in your if you have a lack of control in your nervous system, it's so difficult for you to do everything.
Yeah.
Everything is overwhelming response. So
You
I
make
just
your, oh, sorry.
so I just had a call with a client, just onboarding call today. I was supposed to actually go through a protocol and such, and I didn't realize how much of a emotional burden that she was going through from losing her first child. So we had to do EMDR technique to
Oh,
release trauma issues and working on her heart coherency today for 90 minutes. And I didn't even discuss about protocol yet. Because if you
Right.
don't not in the right mindset, there's no way you're going to do this, right?
Mhm.
You know that the body's craving to detox more. I get it. But if you don't have a necessary right functioning neurological function, especially emotional state, it becomes a huge issue. So we did literally 30 minutes of EMDR just to releasing the emotional stress from her losing a child. And then also she had gone through her second child, daughter, going through cardiac arrest. So she had to do
oh,
CPR. She's alive. She's 9 years old at this point in time. But again, the emotional burden that particular person has is what's carried through within the cells, right? And I think right now, one thing that I also see is that this whole the mitochondriacs out there,
Mhm.
obviously they got to that point in terms of health is because they found that it's improving. But one thing that I noticed is lack of compassion.
Mm.
Lack of compassion. I mean, um, just this not really necessary. It is what I see, and it's too far right in that sense of that, and not having compassion and having to really critically help these people is not the problem. And then, I'm not going to mention any names, but this particular doctor on Twitter is very, very hard hitting in that discussion. It's like, man, you got to be a little more compassionate about people. Not
Yeah.
case, but I learned a lot from him. I respect him a lot.
I think that you make some valid points, and thank you for saying the lack of compassion. Now that you say that, I see that as well, and I think it's amazing you're doing EMDR with your clients. I had no idea you were using that modality. That's
Can you
great.
some don't know what EMDR is. Do you want to just define that?
It's just finally, basically, I only know the basics. I learned it from my therapist as well, but I just noticed that it helped a lot with people and
Mhm.
having
Yes.
issue being overthinking and having an emotional impact. It's just a simple tool in terms of doing emotional release. And the issue is that if you look at more trauma issues, the emotion gets stuck in the body. I mentioned about how fascia impacts into creating that space where the emotions and trauma is getting stuck. This is where EMDR can be very helpful for you. Right. So you recognize the issue into what's triggering it, how it's impacting the particular body, right? And then also thinking about how it's actually causing you to feel about yourself, and then looking at how intense that is. And then the last thing is to help you release that. All right, so some people can be stuck in that route of problems forever, but within 30 to 50 minutes, they're able to get the emotional release they're looking for. And the stuff that they used to bother them doesn't bother them at all. So it's a good ways in terms of marrying this together with the heart coherent breathing technique. So if listeners are wondering what heart coherency is, just type in HeartMath on Google and you will see HeartMath Institute. And there's a particular device you could purchase called a HeartMath device. And it measures your heart rate variability with your heart rhythm and the coherency state. And it's going to be really helpful for your symptoms and your issue dealing with right now. Your cell feels everything. It's not just about the cell membrane, it's like your cells, including your mitochondria, feels everything. If you are internally feeling chaotic inside, that's how your mitochondria is functioning. Mitochondria is feeling as well. It's basically a third person living inside you and sensing everything. Another thing that also happens is your heart feels everything as well. So that's why you have to be more compassionate about your condition and what you're going through. The heart actually has 40,000 different nerves stemming from that, feels everything from the environment and the nervous system issues and problems you're all dealing with. And then that brings that particular information through those 40,000 nerves back into your brain. Why is it that you're constantly getting stuck with that stress response and getting bothered at? That's the reason why. So one of the things that I early on teach with my clients onboarding wise, I don't even talk about supplements, we work on your nervous system first. It's a critical part that we have to do. If the nervous system issue is unresolved, you're just going to go through the same shit all over again.
Yes.
Resolve there, right? You have to break that particular pattern. And this is where you need to chip it away. It's not going to happen overnight, but remarkable change actually occurs when you create the heart coherency in the body. I've seen clients, another lady, she lost her child when he was 5 years old, had a severe boating accident, fell off, drowned. She witnessed that 18 years ago. Constantly to worry about problems after problems, worry about her kids being safe and anxiety, gut issues, you name it. She had all this problem, including hormone dysregulation. Now, she was not in the right mindset to start anything. So I just said, you know what, as a gift for you, I'm going to teach her how to do heart coherency. So did that breathing for 5 minutes. Well, luckily, she kept on doing that for 6 weeks. Did a follow-up, and her face was completely changed, internally and out. Right?
Wow.
Her peace, but the remarkable physical change I saw, her, especially her autonomic nervous system, her resting heart rate went from down to 90 down to 60. That's her baseline heart rate was 90 because of anxiety issues and the problem that she was dealing with. Once we start to create heart coherency, her resting heart rate was at 60. Stuff that used to bother her does not bother her anymore. Stuff that used to be making her react, not anymore. Right? So your body already has the modality to do so. Right?
Yeah.
You could fix a lot of issues by just, 60 to 80% of people are dealing with chronic illness these days are due to stress. And unfortunate thing is that the doctor in the entire medical space, and now is the fact only 16% of those people end up getting helped. Right? So what else is happening right now? Overuse of medications and etc. Right? And if you're using benzodiazepine also, benzodiazepine actually causes cell membrane damage. Right? It's a critical part of enzyme production, end up having to ligate the entire cell membrane because of use of benzodiazepines like diazepam, Presolam, and all that. Right?
Yes. And we see people get addicted to those medications.
I have a pharmacy background, obviously, so I look at mitochondrial dysfunction from drug-induced issues, right? Including like statins, for instance, right? Statins is a mole toxin, actually. Statins are derived from mavolic acid from red yeast rice, and that blocks a critical enzyme called HNZ coenzyme, right? To stop cholesterol production, but also it blocks CoQ10. It also blocks our transport chain in the cell membrane as well, right? So this is what statins do. So, this also impacts in terms of how I think Dr. Jack Cruz posted on yesterday's Twitter about how statins end up having to impact the deuterium content. I didn't even think about that far. I was like, wow, that makes a lot of sense now, right?
Yeah.
He just posted on something you mentioned earlier about the heart having 40,000 nerves, and I really hadn't thought about that. you know, the
Yeah.
heart's.
I mean, yeah,
And
he did post that, but I actually learned that concept from heart math when I was going to their
did
training.
you?
And yeah, it's heart is not just, I mean, obviously I had a heart attack.
Yeah.
Heart is not just about the pumping mechanism. If you want to have a good guess, I would actually recommend having Stephen Hussey on.
Oh, we've tried. Yeah.
Yeah,
Steven, if
we've
you're
been trying.
listening, we've been
Yes,
trying to get you on, but
yeah.
we,
So
we need to retry. It's been over a year.
Stephen Hussey talks about the heart as being as a vortex. It makes a lot of sense. So if you look at the entire structure of the heart, you could unravel into a big sheet. And if you look at the intramuscular aspect into the heart function, it also has like a little spiral tunnel in it. So as you
Yep.
start to pump that blood, it actually helps to structure, energize that heart. So energize the blood, energizing water, structure water that is it. Right. So Paul talks about the exclusion zone criteria and everything else beyond that, the negative ion charge that goes on is a critical part. So when I see clients dealing with neuropathy issues, for instance, one of the things I tell them to do is ground, right? You're adding in structured water, minerals, right? Making sure you have proper sunlight. Those are going to be the lasting change there. And as well as the nervous system aspect of it, right? If you're having particular pain in an area of the body, that's where the emotions are getting stuck. That's not my fault. I would recommend seeing a fascia specialist to release that. But things like coaching that, and then as well as working on the cell membrane. So there's always
Emotion
advanced.
code.
Yeah, emotional code is a great way to look at that, right?
Bars,
If
access consciousness.
anyone out there, living down in Scottsdale, Arizona, my friend Dr. Sean Drake is a chiropractor, but he does a lot of trauma release technique. So you can work with him in a 3-day immersion is a good way to look at that issue as well. It's great practitioner to look at. So I recommend him. I know others that do that. But if you're just looking at biotoxin issues and thinking that all these things are just impacting your body, there's a lot more. There's always a nervous system environment factor. So that's why my methodology called the Encore method really gives you the foot holding in terms of how to looking at clinically as well. So I'm going to open up practitioner mentorship very soon. But how do we look at critical cases and things like that in terms of what roadmap, right? So if I give you the roadmap in terms of how to help the client, I want to look at that context of environmental, the Encore method, to really looking at what the person's dealing with. So it's not just about the mold. Yes, it's an environment aspect of it. What else is happening right now? Right, the non-AVMF part, blood issues, all those things that we could easily ask these questions to decipher what the problems are. And then we're looking at the lens of an N, how dysregulated that person's nervous system is. And then looking at all aspects of the cell membrane issues and cells, that's the C, right? How do we optimize a particular person? Is that person constipated? Is that person not able to digest fat? Is there any other issues that's impacting that person to detox very well? Maybe they're not sweating very well. It's all part of optimizing detox pathway. And then looking at rebalancing microbiome, what are the critical things that we need to address at this point in time? Is it more viral issues? Is it fungal issues? Is it something else that's going on? We got to get the gut fixed. And then the next part is giving the right tools for that client as a clinician to help them get their body back in order to enhancing their resilience and a redox reaction. So not only my methodological Encore method becomes a footholding and a sequential medicine of getting the person from point A to point B in their recovery journey, but utilizing the Encore method as a ways into looking at clinical picture, I can't diagnose, but clinical quote unquote diagnosis of what that person's dealing with, and then fitting the Encore methodology to get that person from point A to point B. So this is how I see it, and then I'm going to open that up for practitioners out there.
Yes, this is what all doctors need to be doing. I hope everybody listens to it.
Yeah, I mean, that is my overall dogma, and this is what God gave me as an insight. But if you are a young practitioner out there, but if you have done many things and getting stuck and feel like nothing seems to work, this is a good roadmap strategy in terms of really helping that. So this is where coming in. And
just makes me think that there's no accidents, right? Like you having that heart attack and then diving so deep. I mean, how much you have learned in this journey, using the steps like functional medicine and then now transferring into the quantum stuff and layering it all on and then figuring out the right order. I almost feel like you should stop treating people, and the emergency here is to train more practitioners, because if we could just get this out there, we could help so many more people.
Yeah, absolutely. the reason I came up with this because I'm not sure. I mean, I'm a practicing Christian, I'm born again Christian, and one of the things, the reason that our Encore method came into me was just I was praying and thinking about this and how, some of the difficult cases, and is the insight that I received is how Christian path of salvation is. So when we accept Jesus Christ as our personal Savior, the first thing that the Holy Spirit does is clean up the environment, right? Cutting off any of the relationship or any of the external factors, the environment is affecting you from walking properly in the walking with God. That's the first thing. And the second thing that God starts to work on is your soul, the salvation of the soul, affecting positive changes in your emotions and your trauma. And all these things are really impacting how that is. And the next part, in terms of the aspect, in terms of how the cells and the optimized detox pathway is all part of the ecosystem of the organs are completely connected to the body, but as mentioned about how the word actually has a double-edged sword to pierce through, the entire body. That's where the critical part in terms of how everything's interconnected, and then the word and the energy aspect of it, light, water, magnetism, really comes in to actually fix this issue critically. And the next part is sanctification. The last part of enhancing resilience is sanctification, right? The salvation of the Christian is the latter part is sanctification. What does that mean? You're walking faithfully in the word, right? Living in the Holy Spirit and becoming like Christ. So that's where the Encore method came in to play. Now, if you're not a Christian out there, I'm not asking you to believe in this part. I mean, that's
Right.
what it is. But I just came with this particular concept called Encore method because in terms of my faith journey, and then as well as my health journey that I've gone through.
Oh, that's beautiful. Thank you for sharing that. And thank you for sharing all the case studies too. We were going to ask you, you really hit on so many things we were going to ask
We
you.
did, yeah.
This is awesome interview.
It's been like a masterclass. Like, and honestly, I
Yeah.
feel like, this is probably the most informative podcast we may have had to date. Like, so thank you. Yeah, thank you for that.
Thank you. It was a blessing.
We like to ask our signature question. We're near the end here now. What does quantum healthy mean to you?
Quantum health means to me about aligning and creating coherency in the body, and creating life.
Yes, I love that.
Wow.
Short and succinct. And that's really what you explained today, really. I mean, so many good tips, and I really took away that the sequence of things matters, timing matters. I mean, this is what we talk about with circadian health, is all about timing. So many things came together today. Dr. John, thank you so much for being here. I know
Well,
Laura.
first we have to make sure, how do people reach you? Are you on
Yes.
social? Do you have a website?
Absolutely. I'm very active on social media. You can find me on Instagram is john.pharm.D is PHARMD. And then my website, you could follow Dr. John Kim, all one word, right? And then you could go there. You could learn about what the Encore method is about. I also have a free questionnaire there to decipher what kind of issues you're dealing with, health issues you're dealing with. It's absolutely free. Make sure you join the community, because I'm going to put that questionnaire into the community aspect. So that's only be available for members. Right now it's free. I'm going to have pay membership very soon in the subsections in terms of like protocol wise, any new courses and such. So definitely visit my website.
Okay, awesome. We will make sure that's linked in the show notes.
And you must be on X, because you mentioned
No, I'm not very active in X. I just like to
look around.
But I learn a lot from, again, I love Dr. Jack Cruz's work. I learned a lot, especially like the critical part in terms of how quantum biology and circadian rhythm end up having to impact the body's function in terms of recovery wise and such. It just simplified my protocol. So it's really.
Yeah. Oh, he's helped so many.
Yeah, you really brought home the redox before you detox. That's something we say in this community, and you explained it so beautifully.
That is so true. I'll give you a little formal thank you. Thank you for your time today. It sounds like, I mean, you already got off a client call this morning. We know you're super busy. But thank you for obviously surviving your heart attack, to teach the world your truths, and just and your spiritual journey to find the Encore method, because it's going to help so many people. Again, thanks for the masterclass you gave us today. And just also just you hinted, you touched on it, but changing like the approach at looking at health through cellular systems, you know, and not just symptoms in isolation. And we just love how you're highlighting how important it is to fix the environment, the nervous system, the cellular function, and how they're all interacting, because you have determined like it's either your health is going to improve or you're going to stay stuck, right? And like the way you explained cell danger response, never heard it ever like that. Yeah, I think we all should dive into Robert Navio's work and learn more about this, because I think it's affecting more people than we realize, right?
Well, I did a first lecture on cell danger response back in 2021. And that was really helpful. But as I start to dive more and more into, the circadian rhythm, quantum biology, and cell membrane, it's really fitting into why that concept makes sense. So even my lecture on cell danger response is heavily evolved in that. And now actually putting the Encore method into creating, that's a critical part. Like the reason that the cell danger response is occurring is because the body is lacking safety, right? So you have to create that safety first. Environment matters in your nervous system. Those critical things. If your house is in shambles, it's not in a right order, and it's causing you to be in a dysregulated state, it's very difficult for you to heal. Your healing environment, your home has to be a healing environment.
Can't get well in the same environment we got sick.
That's
right?
it. Yeah.
And that's why light matters.
Yep, exactly.
Here, on light, I'll finish with this. Thanks for your evolution, from, obviously a pharmacist to start. So you were probably, prioritizing medication as a mainstream compounding pharmacist. And then you went more to supplements, probably with functional medicine. And now you're prescribing light and circadian rhythm to get back the signaling, that only nature can provide. So bless you for coming on our podcast today, Dr. John Kim.
I appreciate this.
Yes, thank you everyone for listening, and we'll see you next time.
Thank you so much for listening to the Quantum Healthy podcast. We hope you found some value in this information, and if you feel inspired, please share it and leave us a 5-star review. This will help us reach so many more people. If you want to connect with Laura, you can find her at laurakissmannwellness.com and Andeea at andeearay.com. Links are below in the show notes. Now, go find some sunlight and embrace your own quantum healthy.